Welcome to our webinar, Listening to Community Voices, Questions and Concerns about COVID-19 Vaccine. We are so excited to have you here today for what has been a series of webinars breaking the silence around misinformation, disinformation, helping people understand what they need to do to protect themselves, how to get a vaccine, and our need for new vaccine trials. Welcome to the University of Maryland Center for Health Equity, Listening to Community Voices, Questions and Concerns about COVID-19 Vaccines. My name is Dr. Stephen Thomas. I'm going to be your host today, and I'm so excited to introduce you to the rest of the team. We have a very robust panel discussion for you today. I'm so very excited to introduce you shortly to Gloria Aparicio-Blackwell and our moderator, Mr. Omar Neal. And as you can see on the panelist list, the panel members that you're going to hear from today, we have a few errata. Dr. Sandra Quinn will not be with us this evening, came down with a little under the weather, we'll call it, but she's in fine recovery. And Dr. Ernest Carter may be late joining us. He is the medical director, as you can see there, Prince George's County Health Department. And here in Prince George's County, we are the hotspot in the state of Maryland. So you can imagine all the challenges that our health professionals, our public health professionals are facing at this moment in the pandemic. Again, I'm Dr. Stephen Thomas, and this is Gloria Aparicio-Blackwell. And I'm going to, Omar Neal, former mayor of Tuskegee, Alabama, and host of You Got the Power, a radio show. Omar, are you out there?
I'm here, Dr. T. I'm here and ready to really get involved in this wonderful conversation we're going to have with people.
And Gloria, are you out there?
I'm here, Dr. T. Can I ask you for just a moment of silence for the more than 400,000 people that have been taken by COVID?
Well, let me say this to you, Gloria. As we are speaking right now, Vice President, President-elect Biden and Vice President-elect Harris are holding the ceremony right now as we speak. And we actually have a moment before we begin to do just that, to do that recognition. So thank you very much. We cannot forget what has happened in this country, the burden that we face, the challenge ahead of us, and hopefully the light at the end of the tunnel. And so we will have the final recording of this event posted. And so you'll have detailed links to the bios of our panelists. I'll ask, I have to announce now that we will be recording this this webinar. And so if you would, that's part of simply, I have to acknowledge that and let you know that we will be recording. And so you're gonna meet these panelists and you'll get more information about them on the website. And I don't want to forget the fact that behind the scenes, we have a whole crew making all this work. And so I want to acknowledge the fearless scholars here at the University of Maryland School of Public Health. They are graduates of our School of Public Health, and we're very pleased to be training the next generation of public health professionals. My one commercial, the Center for Health Equity, please visit our website for updates on upcoming events and other information about addressing health disparities in the context of a pandemic. Let me also just give thanks to one of our sponsors, Communivax. This is a coalition to strengthen communities' role in equitable COVID-19 vaccine distribution. And you'll be hearing more about the Communivax campaign and the rapid response teams that have been launched and established around the country. I'm one of the leads here in Prince George's County, and on the panel, we have leads in other parts of the country out in California. Dr. Isabel Duran is also part of the Communivax rapid response team. So in our discussions, we'll have a chance to learn more about that. And so let's say at the very top of this moment, And Gloria, why don't you take us right now to acknowledge where we are, where we've been, and hopefully what the future will be.
Yeah, what right now, as you can see, that all these what COVID have done to all of us, 400,000 people, and now we are in the process, in the midst of getting the vaccine to be injected to all of us soon. That's what we want. We want to come back to normalcy. We're gonna go back to see each of us, each one of you, and having the opportunity to see our families and visit our communities and be a country that is united again. And let this process to be the uniter and the having the opportunity to all come together. Amigos y amigas, estamos en un momento difícil, pero yo sé que con la vacuna podemos conseguir esa luz que necesitamos. Se han muerto más de 400,000 personas. Que no siga esto, que sea el momento de la unificación de este país y de todos visitarnos y de ser una comunidad nuevamente.
So
Back at you, my friend. So let's
take a moment of silence for all who have lost the loved ones left behind to remember.
Thank you.
Okay, here we are in the Hollywood Squares. We want to welcome everyone. And, you know, one of the things that we've done in the past, Omar, is that we've asked people to take stock of where we are. We just had a moment of silence. And Cameron, are we ready to go with our first word cloud?
Just enter the link into the chat.
We want people to go into the chat. There's going to be a link there, and follow that link and enter a word that best reflects what you're feeling right now at this moment in the country, at this moment during this pandemic. And you can put in as many words as you want. Just put one word at a time, hit return, and just keep it going. We got 60 seconds. Time starts now. Now, Mr. Mayor, one day we're going to have some music to go along with this.
What you talking about? Like Hollywood Squares or one of those game shows or something, Dr. T?
Do, whatever.
Yeah.
So put your words in, keep them coming.
You know what's interesting, Dr. T, and I'm so glad that Gloria, brought it to our attention, although we plan to do it, is to look at the enormity of the death toll that's taking place. It's surreal. I mean, when you're talking about 400,000 people, just 100,000 from 500,000 people, of our family members, of our fellow citizens, that's enormous, and we don't want it to be lost and become immune to what is happening in other people's lives, or the pain that other people are feeling. When one is feeling pain, we all are feeling pain. And so I'm glad that we are talking about how we can heal together now, not only from our loss, but heal together so that we will mitigate and reduce the loss in the future.
Now, Cameron, I see some people putting their words in the chat itself. And so, yeah, put that link back in so that they can add it to the link. And then, are they seeing what I'm seeing? I'm seeing the word cloud being built right now in front of me. Is that what everybody's seeing?
Everybody's seeing it, yes.
Okay,
Yes.
We've got another 15 seconds. Keep those words coming. Look at that word cloud grow. Keep those words coming.
Hopeful. I'm so excited to see that word coming over and over again. So hope.
Okay, let's stop right here and just take a moment. We might have to put that up just so they can see that. Put it up one more time just so we can see where it ended up. Okay, now I'm actually, given where we are, we had a moment of silence for 400,000 plus who have passed away. The trajectory of infections is going up, not down. Hospitalizations are terrible, especially out there in California where you are, Isabella. But look what that big word is in the middle: hopeful.
Exactly. You
So
know,
as
so
yeah, go ahead.
I just looked up, there are over 2,500 COVID cases yesterday in California. That's the latest data. And I looked through all the wording, and I had put in resilient, because above the hopefulness is because we are a resilient people, and particularly communities of color who have been so horribly impacted by this disease, that underneath it all is a resilience based on lived experience over time, passed down through generations of understanding and survivorship, that we have come to be, without recognizing it in some way, resilient. And Omar had in this show he does, Hope, Power. And I think that what we don't recognize is, with resilience is a power. And we showed it in our elections recently, when we came out and we used the power to vote. And I think where we need to demonstrate our power is how we all stand up and decide to get vaccinated to save our communities. That's
Now,
resilience.
thank you. And the panelists, while we're here at this moment right here, speak to what you see on that screen. Just jump right in there. This is a conversation, community conversation. Speak to what you see.
I'm excited.
Go ahead, Josh.
This is Jocelyn. I'm excited. You know, I'm excited because we do have the vaccine. I'm excited because on Saturday, I actually received the vaccine in order to show our Black and Brown communities that it's okay to get it. And you know, I'm excited because there was a lot of work that was done to create these vaccines. There's a lot of scientists that did a lot of work, and it is safe, it is efficient, you can trust it. And we need our communities to get it in order to build enough herd immunity, you know, so that we can get back to the way things were in 2019. Wouldn't it be great to be able to hug someone, right? You missed that. You know, I missed that. It's important. I'm excited for the future.
Floor is open. Panelists, speak to what you see.
So this is Yolanda, and I'm really excited looking at this because the word hopeful just really pops out, and it tells me that people are optimistic about receiving the vaccine. But at the same time, I do see the words in the background that I think people are also expressing: concerns about misinformation, anxiety, feeling overwhelmed and anxious. And I think that we need to be able to address those smaller words that are around, so that that word hopeful can just really grow and explode and be even larger.
You know, you point out that the hopeful could also be fragile if those smaller words around the edges are not addressed. Keep the floor open. Panelists, few more.
Isabel here. And sorry, everybody, because I'm a journalist by training, so I tend to always stick my nose in, even if I'm not asked. But I wanted to say something that Jocelyn brought up and that I've brought up before that I'm very concerned about. And that is this thing called herd immunity. A very smart, wise man said, it sounds like, you know, we're rustling cattle. And I think that we need to rename that for our own communities to get a visual image that makes sense to them. And that is community immunity. That sounds embracing. It sounds like everybody's in it together. It sounds like something we all understand at a very, you know, lived in level, which is community. And we all need to get there in order to bring not only physical health back to our community, but financial security back to our community. We need to have community immunity. What do you think about that?
I like that, you know, because community is two words. It's common unity.
There you go. Thank
Oh,
you.
look at y'all linguists playing on here.
We don't need to say anything more.
Let me go back
No, it's all said and done.
Absolutely.
you know, that's how we flow here. But think about this. Hope is very important because it's tied directly to faith. Faith is the substance of things hoped for and evidence of things unseen. So although we don't see right now a full immunity, we don't see herd immunity, whatever you see. We know that it's coming. So that's why our hopefulness is based on our anticipation of what will happen in the future, although we don't see it. That requires faith. We believe that the people who put this vaccine together, we believe in them. We have faith that although we don't know, that they know, and that if we do the things that we need to do from our angle, to include wearing our masks, social distancing, washing our hands, just basic things, then we can make it to that other side where we can, as Gloria says, see our family again, see our friends together, come together and commune as a community.
Now, Isabella said something that I think is important right now. We have been abandoned by some of these agencies that we've looked to protect us in the past. And I think that has opened the door for us to, in a sense, save ourselves. And some of that saving ourselves is changing this language. They have given us an opening to change this language. That herd immunity comes from veterinary, public health. We understand, but we're not cows. And if we can get away from language that dehumanizes, it will help in our communities. So Isabella just gave us a new term. And when we open up the discussion, have our scientists also speak to this, is it a term that makes sense? Is it a term that works? Is it a term that communicates what the ultimate aim is in terms of protecting ourselves as a community? And if so, we need to push that forward and adopt new language that puts a heart and a soul back in the messages that we're sending in our communities. Now, Cam, let me know when you're ready for the poll. First poll.
Before you leave, Dr. T, about this conversation, the other word that I put is impatient. Impatient because now you see when it's going to be my turn to get the vaccination. It seems like a president-elect is going to be for his first 100 days that we have a vaccination. We have vaccinated 100 million people. Where do I fit into that? And I know many of our community members that I speak to, they're always asking, I don't know when is my turn. I know there are some guidelines from the CDC, but what does that mean for me? Am I going to see it anytime soon? I want to be part of this effort of getting immunized and then be able to see my family and be with my friends and all of that.
And that frustration is growing. I've got elderly loved ones, elderly neighbors. They don't live on the computer trying to figure out when am I going to get that phone call. Now, Matthew, you want to speak to any of those words, my friend?
I think we just need to remember that as much as the challenge is, there is hope, but that hope is tempered. And it's tempered by the continued suffering of people who have already had the disease. And so we're looking at a group that are looking at this webinar that are forward-looking of the vaccine. They're forward-looking for what could be in the future. But there's a lot of people who are stuck backward-looking because they've already been ill. And that is the part that we must not forget, is there are people, yes, 400,000 people that have died, a number that we cannot even conceptualize really, right? We think about 9/11, 3,000 people died. This is so many more times that. We're having a 9/11 every day. And who is dying? Black and brown people are dying every day. But it's the disability for the people who continue to survive. And that's what we don't talk about in those numbers, is who are the long haulers, who are the people that continue to suffer. And those people are still looking for their hope, because the vaccine can only give so much hope to somebody who's already been infected and somebody who continues to be ill.
And along the way, you have the caregivers, the people, the loved ones who are doing the care. And some of them end up in Katrina Randolph's chair to get their hair done. Katrina, you want to speak to any of those words you saw? You're muted, Katrina.
Oh, yes. Wait a minute, I gotta get in the line. Sure. First, a lot of my clients that sit in my chair was very apprehensive about getting the vaccine. But once all the information came out and they got better informed, then they feel a little more comfortable with now getting that vaccine to help stop the spread of this virus. So yes, I'm starting to hear a lot more positive information from my clients.
And Katrina is part of our barbershop health network, a whole network of barbershops and beauty salons where we're bringing this information to people. And Katrina and her colleagues are really influencers, Matthew. When they sit in that chair, something happens when that cape goes on. Shame goes away. And they actually talk and have authentic conversations. We need Katrina and her colleagues to be partners with us so that we can address the needs of the community. Before we go to the poll, Gloria?
Yes, I just wanted to mention something that was posted here in the chat. The lack of, we're hopeful that we want to get the vaccine, but it's still that number of people that have a lack of trust of the vaccine. And also I'm going to be speaking about the immigrant community, those that are undocumented in this country. They are feeling afraid. What is this is going to mean? Are they going to be tracking me down? Is this more information? So we have to ensure in some ways that regardless of their legal process that they are here, that this is important and they also get the vaccination. So that is not only not trusting the vaccine, but also the legal status that might be also another challenge for us to address.
Well, then you be mindful, Gloria. I just had to go online to fill out the form to get my date. All that information they asked of me might be information your community, some members of your community don't want to do online.
Yep.
Yes. And if you don't do that, you can't get an appointment. So we got work to do. We hear from the community. We must be advocates to lift up their voices and concerns and take them back to the institution we come from.
Right.
And if I may, just a second, so the legislature we're in Maryland in session right now. So those are some of the issues we'll be discussing, but you also have HIPAA laws, right? That protect us as well. And people need to become aware of them. What do? They protect you that your health information cannot be shared with anyone. Okay. La información que usted da sobre su salud a su médico no se puede compartir con nadie. Tenemos leyes federales que proveen esa protección. The other thing is that because people are having difficulty getting an appointment online, like the elderly and the immigrant community, they're creating now a phone number, different jurisdictions where people will be able to give you an appointment and call you back. Okay, si usted no puede usar la computadora para hacer la cita, para poder obtener la vacuna, van a tener un número de teléfono donde usted puede llamar, le toman su información y le pueden ayudar para hacer la cita. Así que tenga un poco de paciencia. We just need to have a little bit of patience because everything is so fluid right now. But those are issues that policymakers are considering, and we are definitely going to be addressing it.
And that's why.
But Stephen, it's really, Dr. Thomas, it's really crucial that we recognize that from state to state, different jurisdictions have different approaches and different plans. So maybe a phone number access in the state of Maryland doesn't exist in the state of Iowa. So we're telling people in multiple languages, and sometimes we're giving them this information, but it really doesn't apply to them locally. And that's when they come back and they say, I'm confused. I'm getting all of this information. I don't understand. And so we ourselves need to be sure that when we're communicating, we're telling the right people at the right time about the right thing. So it is really targeted, not as globally as we'd love the answer to be. We need to be, which is why I love the whole concept of community health workers, or your barber group. I mean, the barbers and hair, exactly. That's fabulous. I think these are wonderful solutions at a local level.
Let me ask a quick question here quickly, because I know there's a lot of in the chat about the social security number. Is that going to be part of the questionnaire in order to get your vaccine? And if it is, that's going to be a huge issue then.
I just filled out mine. Social security number is not required. Okay. I didn't have to put my social security number. It also asks for, if you have health insurance, for you to scan the card. If you don't have health insurance, the vaccine is free for everyone. Let's just start right there. The vaccine is free. La vacuna
es gratis.
No tiene que tener seguro. You don't have to have insurance. It is free. Gratis.
So Omar,
Del número social.
So why, if it's free, why do you ask me for my insurance card?
And the reason is that if you have insurance, we want to be able to collect money because the counties are paying for it all, right? And the state. But if you have insurance, we say, do you have insurance? And we'll go after it from the, you know, we have your social security, excuse me, your insurance card, we'll submit a claim, but it's not necessary. It's just to be able to collect some of the money, but it tells you it's not necessary. Okay, it is free for everyone. It's gratis.
So Mr. Mayor, you can see this conversation's already started. We got to get this poll in. Cameron, are we ready for the poll?
Just enter the link again in the chat. Yep.
Okay, so go to the chat, everybody. There are 93 people in here. Go to the chat. There is a link. Go to that link. And Cameron, you may have to put that in more than once if it scrolls away, and answer the questions in the poll. Now, when it says, I'm skipping the registration. The question is, based on what you know today, select a response that best reflects your attitude towards the FDA-approved COVID-19 vaccine. You can respond once, so pick one of these. When it comes to getting the vaccine, first response, no way will I take that vaccine. Second response, hey, I'm thinking about it, but not right now. Third response, hey, I'm excited about getting the vaccine when it's my turn. And the last response, already received my vaccine. Pick your response now.
And Dr. T, let me go back to something that Isabel said that I think is important to recognize. People in different places have different relationships with government. Trust levels are different based on different cultures and different races. And it's not just relegated to the vaccine. It's distrust of the criminal justice system, distrust of many different systems that have really been abusive to them. And so when you say that you've been abusive to me with all of these other systems, what makes me think that you're going to be fair with me on this one? And so I think we need to be spending our time not just trying to get people to trust, but to show how we are trustworthy.
Yes.
And I think that needs to be the focus as well.
Listen, you're meeting Isabel Duran for the first time, but I'm telling you, the two of you are resonating across the country, East Coast, West Coast. Actually, you're down south in Tuskegee, Alabama.
Absolutely.
This is the one time where health actually, where we as medical providers can actually help people more with their health. Usually healthcare and access to healthcare can only really help 20% of people's problems, because most of the issues are housing, are sanitation, or other issues that health system can't control. This is the one time where the health system can control access to this one thing that can really make a big difference. But people aren't used to that this can actually make that big difference, because most of the difference is made by things that we as healthcare professionals don't have actual control over. And that's a hard adjustment for people to be able to make.
So Matthew and Cameron, go ahead and show the results while we're still talking. Matthew, that distinction is a distinction between kind of clinical medical care and public health. I don't think we always know that difference, that the public health system is there for the public good. Now take a look at these results.
Wow, 36%. Wow.
Now, what we don't have is all the demographics, but we've been doing this. This is like our 5th webinar when we do these kind of polls, and these numbers have moved in the direction toward more acceptance, more willingness to take the chance. There's still wariness, but there's excitement out there about getting the vaccine. And this is why how fragile it is if they get frustrated that the systems get clogged, the websites go down, nobody answers the phone. All this could be eroded if we're not careful.
I think, Stephen, in some ways, maybe the folks on here were actually preaching to the choir, but that choir can now be expanded to go out and preach the gospel, right?
Absolutely.
Given I took it, I'm fine, just a little throb in the arm. I didn't feel so good, but I'm okay. Or I'm really excited and waiting. I'm going to keep trying. Let me help you if you need help. It's really about reaching out, reaching back, and so on. But in the Latino community, when you look at some of the data, there are about 1 out of 3 who is super hesitant. In the African American community, it's more like 48%. So, and you know, pardon me if I got that data wrong, because I'm looking at stuff that's a little old, back from September, and things are constantly changing there as well. So I'm concerned mostly about that 1 out of 3, because the 1 out of 3 can also cause a cascade within their own family or their community. If they come out with what we call the chisme, that is, they heard something and they're suddenly sharing it with somebody else, and it grows into this humongous issue. And suddenly, you know, you've got a whole group of people who aren't going to do the vaccine. And so that is why whenever we hear something that is patently wrong or needs to be addressed in a respectful manner,
Yes.
in which we can create that trustworthiness, we need to address it. We need to have the right fact at the right time for the right person. And hopefully you begin to reduce that lack of trustworthiness, either in the system, the vaccine itself, or the chisme, the miscommunication.
Isabel, think about this. You told me that you had the vaccine, but I never would have known it unless you told me. But what if you had some kind of button, like when we vote, we have some kind of sticker said I voted? What if you had some kind of a button say that I got the vaccine? Make sure you get yours.
Yeah.
You know what I'm saying? Then we can communicate to people even when we don't communicate to them. There are ways that we can communicate. And I think that's what we have to do to get critical mass. People have to see people who've taken the vaccine and look normal to them. Yeah. Right?
I actually recommended to the state of California that we put up those electronic billboards all over the state that show the ascending numbers of people who've gotten their vaccine, with these messages that go with, I got my vaccine, did you? Right. That, you know, any kind of thing, or I got my vaccine to make the community safer. What about you? Anything that begins to touch the heart and the soul of people, to say, okay, I want to be one of those, you know, gamify it to some extent, and not out of disrespect, but challenge people, right? Find ways to get them to engage. And so I agree with you. I think it's really important any ways we can, but always with respect for the audience we're talking to, that if they don't jump on board right away, that we're going to help them come to where they need to come to.
You know,
we need to acknowledge what the side effects are, that there are side effects of the vaccine. And we need to acknowledge that, because people are looking and thinking, oh, there's all these side effects. We need to acknowledge there are side effects of the vaccine. But we also need to say, well, on balance, the side effects of the vaccine are a heck of a lot less than dying of COVID. So we need, when people have the hesitation because, oh, well, I heard of the vaccine side effects on Facebook or through the chisme, otra cosa es así, we need to acknowledge that. When we don't acknowledge that there are side effects to the vaccine, then we're stopping people. They're not going to listen to us if we're not acknowledging what they feel. But when we can acknowledge, look, yes, there are side effects to everything. There's side effects to the vaccine, but the side effects of not getting the vaccine are so much worse.
Right.
And that's the message really needs to be.
Matthew, you are correct. And just in California, I understand that they put a pause on the Moderna vaccine because of some side effects that they saw. And so, you know, so what happens when people trust you and you don't tell them the whole truth? That's part of it, is managing expectations. And I think, Matthew, you are absolutely correct that we need to manage expectations. We need to be able to tell people the truth, right? And let them weigh it out for themselves as to cost benefit analysis that they make for their own lives. but let's give them the truth. And I agree with you 1,000%, Matthew.
And we'll keep
But you have
talking.
to
We'll-
have-
let me
we'll
say
keep
something.
talking. I just want Cameron to get the next poll ready. Our last poll. Just get it ready, Cameron. Get it ready. Gloria, go ahead.
Yes, one thing I will say though, any medicine, we even Alka-Seltzer, even in that, they also have side effect. The vaccine also had that fact sheet that we had to read. So I think it's a matter that this is not different than any medicine that we take too, that they have side effect. People may react completely different. So that's something that we had to put out. But one thing that I want to ask the panel here too, to give us, where do we find the right information? There is so much out there. There's a lot of misinformation, but there are places that we can trust. So if we can give the audience, because I see in the chat that they want to know, tell me then, for those who are not convinced to take the vaccination, where should I direct them and what should I say or encourage them to read?
Well, I think they're in the right place right here, because one of the things that there is so much information is that it needs to be curated. It needs to be packaged. We're asking a lot of people to understand how vaccines are developed, to understand how the immune system works, to understand a new platform, mRNA. And when they say, well, does that affect my DNA? Does it? You can't say, oh, you don't understand virology or you don't understand genetics. We cannot shame people. We're asking a lot. We have to start listening and spending more time. And so here's our last poll. Are we ready, Cameron?
Well, he's pulling it up, Stephen. I think what's really exciting about what you've just said is that, in fact, we've reintroduced the idea of science into our communities. And I think there's some excitement around it. I'm hoping we've driven some new young scientists to step up in our communities, because it is such actually a worthy thing. And we're showing that science does matter.
Okay, so you mean, here I missed this one. So go to the chat, click on the link, and here is our last poll. In your opinion, what might be some of the motivations for people who have received the FDA-approved vaccine or who are actively intending to get vaccinated? Check all that apply. And we have enough people here, Isabella, who actually have done this, that we can really understand what were those motivations.
Mm-hmm.
Now look at this. This is quite interesting. Keep on responding to the survey while we keep talking. Now, if you look at any news, the commercials that the pharmaceutical companies put on are amazing. They've got these wonderful people having wonderful times. And if you listen and they start listing the side effects, your right arm might fall off. You might get impotence. But the music is so great. They're having so much fun. So they have figured out how to give those facts in a palatable way. But some of those side effects sound much worse than what we're talking about the COVID-19 vaccine. We have to give people comparisons. We need
Can
better.
I tell you why I got it? Since I just got it on Saturday. And
Why?
I decided to make that decision for many reasons. First and foremost, my father died of COVID.
Oh.
My cousin died of COVID. Two very close friends of mine died of COVID. So the personal loss have been incredible. And I know many people, some too, which are in the ICU right now, and one may not make it. So knowing someone that has been affected, experiencing a loss, made me think about it. Plus, I learned about the different vaccines, right? And I started reading, and I thought, sort of doing a balancing act, what outweighs what? And at the end, I decided I want to live. I have 3 kids, and you don't know how this is going to hit you. And I'm a Black Latina, and I'm in that group where we are affected. So it's all the knowledge that I have gotten from reading, and I want to protect my community and my family as well. So I think that what we need here is you need the message to be clear, but you have to have the right messenger. You have to spend money in our communities of color. Public health has been underfunded for decades. This is not new. We have all these health disparities. We need to spend money in our communities, and we need to get the right message.
You know, and the
Jocelyn?
other thing, in addition to that, Jocelyn, is this, is that we need to make sure that we are going to places where people are. You know, if it's in social media, then we need to take these kind of conversations into the social media space where people are getting proper information. Because if we don't, then the negative and false information has no competition. And so silence means that maybe that's true. And if it's nobody to contradict what they are hearing. And so we need to go every place where people are receiving information. We need to be very intentional and deliberate about going into those spaces.
Absolutely, Omar, and that's one of the reasons why I'm a big champion of community health workers, because I think every one of our communities of color utilizes community health workers. Stephen likes his barbers and hairdressers.
I've seen them in action.
I still call them, oh, I know that, you know, how many times have I spilled my beans to my hairdresser, right? So I know that these are invaluable boots on the ground, excuse the militaristic expression, but they are so invaluable to our link from the community to the healthcare system that they are the ones that can make the change. But look here, Stephen, at this poll, C and F, they go to people's values.
Yes.
The reasons why almost 50% are choosing to do it because of somebody else. They want to protect the community. They want to protect their loved ones. And we know, based on research, that people make their decisions, and I see this in the Latino community as well. They make their decisions based not on facts, but on values.
Yes.
And
Now,
you value your community, you value your loved ones, you want to help others. These are the messages or the expression of truth within those messages that I think will resonate more with our communities than a lot of other hard science.
Think about this. What if we took what people are saying here and then framed the issue around what people are saying?
Thank you.
Determines who embrace the cause. That's the critical thing. How you frame the issue determines who embrace the cause. We need to spend more time framing the issue than just going out talking.
Yeah.
Go ahead. Was that Yolanda? Go ahead, Yolanda.
Yeah, I was just going to jump in and respond to Jocelyn because I also received the vaccine. And it's interesting how much she and I had in common. You know, it's really personal for me. I'm a nurse, but I also have several other family members that are first responders. My brother's a police officer, and he was exposed and had COVID. And he's a long hauler, as people are calling them, which means he had COVID in June. And it's now January, and he still can't walk a block. He's short of breath. So he's had COVID for a really long time. My uncle, who fixes air conditioners and furnaces in people's homes and continued to work, has COVID, and he's still in the ICU. And I'm not sure that he's going to make it out of the ICU. My aunt is a nursing assistant. And she's working in a local nursing home, and she had COVID, and fortunately her case was not as severe. But I think it's personal. We know that Black people and people of color are disproportionately impacted by COVID, and that we don't have the same privileges all the times to be able to work from home. We might not always have the same privileges to social distance because we live in a home where we have lots of people and social segregation, and we can't move around. We know that many people within the community are already impacted by other disparities like hypertension and diabetes, and increasing the risk for COVID. And so when we think about why people get vaccines, we have to think for many people like myself, it's very personal, because what we're weighing is what Matthew was saying, was the life or death. You know, and the COVID vaccine really offers us an opportunity to get a vaccine that can help us not have as severe of a case as COVID and to be less likely to die from COVID. And that's incredibly important to me, to my children, to my parents. And so I think we have to be careful about how we're framing the messages. So I like what you're saying about shifting the message based on these conversations.
Now, Yolanda, stay on the mic for a moment. And just, you're a nurse. Some of the folks here are caregivers for their loved ones. They may not have medical backgrounds, but their loved ones in a hospital.
Mm-hmm.
Did you have to advocate on behalf of your loved ones when they were in the hospital?
Absolutely. And it's something that I've been tremendously worried about. What happens to other family members that don't have a family member that's a health provider to help navigate them, this system for them? My brother was initially not offered remdesivir, for example, a medication that would reduce the severity of COVID. And I had to call and say, why not offer it to him? He has hypertension, he's obese. Why would he not be a candidate for it? And it took multiple phone calls for me to really be able to work with people to say, but what happens when we don't have a health provider? My uncle was in the hospital for a short period before people were saying it was no hope. How do we, I had to advocate to say, why not just push a little bit further to see if we can save them? So I think it's just incredibly important for us to understand that there are many, many people out there that we know part of health disparities is even if you make it through the door, you might not get the same quality of services that you would if you were not a person of color. And so we have to also keep our eye on making sure there's equal access to vaccines, but we also have to make sure there's equal access and equal treatment. Once people get in the hospital, they get the high quality care that we all deserve.
Now imagine if you have a language barrier on top of that, my Latina brothers and sisters.
That's the challenge. That is the challenge. Now I see in the chat that they're asking, what are the side effects from the vaccine?
So we're going to open up in a moment and take some of those questions. I want to keep it right now just for a moment on our panelists. And Matthew, if you have anything to say related to the advocacy, once our loved ones end up in these systems and have language issues, what you have to do you have to drop the doctor name? Do you have to, I don't know. How loud do you have to get the attention for your loved ones?
You have to get pretty loud. It is definitely challenging. My grandmother also died from COVID in April when we had the spike here in New York. And it is incredibly difficult to be able to get anybody to listen to you. You have to really push very hard. Like Yolanda was talking about, it's very difficult to be able to get somebody on the phone to say, but there's this you can do. You have to make that choice. So behind the scenes, when we have patients that are coming into my health center, that their relatives are in the hospital with COVID, of which we had many deaths. We have to be telling them, coaching them, okay, you need to say this, you need to ask this question, you need to push, unfortunately, you need to make the medical team a little uncomfortable that you know too much and that you are asking the right questions. Because when you ask the right questions, you're more likely to get a better response. And it's unfortunate that it has to be that way. But because of language barrier, you have to pretend like you know a lot more than you do. And, we're fortunate in certain hospitals that we have in New York City, there are a lot more Spanish speaking providers available. And so it's easier in those hospitals, but there are hospitals even within a 5-mile radius that you can't find a Spanish speaking provider. So for the folks that I take care of, they're not able to ask and directly speak to that provider. And that creates a huge challenge and another disparity in the care that people are able to get. So I push people to push as hard as they can, ask as many questions, again, make people as uncomfortable as possible, because that's when you're going to get the best care. It's unfortunate, but that's the way it has to be right now in the system that we're in.
Matthew, let me keep you there, Matthew, a second, because one of the problems that we have is that people saw the president of the United States get COVID. And within a day, 2 days, he's out with a normal life.
Superman.
Because they said they gave him some kind of cocktail. So the question becomes, is the cocktail just for certain people, or is it for everybody? And if you can save him and all of the people that he knows, then why you have 400,000 people dying?
We have to address that.
The
That
ultimate
was
irony about that cocktail that he got is that cocktail was never used on anybody else. He was experimenting on himself. We talk about Black people being experimented on, and they have been in this country, Tuskegee, etc. He actually created an experiment on himself, which was very strange. And it was strange that the doctors agreed to do that, given the fact he was president of the United States. That combination of drugs hadn't been used on anybody else.
I think you
But
call
yes,
that
people look and they
4%
see that this somebody who's so powerful are able to get that, and they can't get it. But we're all equal in this country, supposedly. Under rule of law, we are all entitled to get the same medical care, and we have that right. It's not a privilege to get that care. And so we need to remind people that they have to assert themselves for that right, because it is a right and it shouldn't be a privilege.
I think
But we
that
have to
one
give
that
people
goes
information.
to the issue,
Go ahead.
excuse me, that goes to the issue of power. And therefore, what you're teaching when you teach patients to be their best advocates, you're telling them they have the power to advocate for themselves. And maybe the best advocate, but the only one to be there. So they need to utilize that power. But the second thing you're talking about is inequality of care, and that is de facto discrimination. And that has been for centuries and decades in communities of color. So we're hoping, at least from my vantage point of all of the organizations and people and academics I'm talking to, is that we're really, through COVID, really trying to push a system to be different. The whole infrastructure needs to change. And if public healthcare systems do not take the lead on this, do not in fact show, and some of them are not showing much change, not being very nimble, because I hear about some of them working with community people who are moving faster than they are to get information out to the community for vaccination. So we're really pushing change. We're pushing against inequality, discrimination, racism, and we need to be armed with those tools. And the advocates, who are the patients themselves, need to be part of that change.
Sounds like
But
we
you
need him.
need to, I think that every state, and I know there are different states here, should declare racism as a public health crisis.
Okay. Snap.
And you have to start there, because then you realize that it is a problem, and you inform your policymakers that this is a problem, because this is not just having access to healthcare. It is all those social determinants of health, like Yolanda was saying, that affect us, Black and Brown, because of the way we live. We're essential workers, minimum wage, education, the environment. And it's decades of prejudice and racism. It goes back to Jim Crow. It goes back to, slavery, and all those systems that work against us. We now must do something about it. This is the time for us policymakers to do something about it, because otherwise we have short-term memory and we're never going to do anything to make change. So COVID has been horrible, but I really think as we look at all those words, I'm hopeful that we in the future can close the gap and reduce all those disparities, which are so important. In my office, let me tell you, I get calls of people that call that their loved ones in Spanish are in the ICU, and that they feel they're not getting the right care. Do you know that I have held 3 meetings with the CEO of the hospitals and the families to translate? And then I had to call, because I sit on health, I have access. I can call the hospital and say, that family needs a translator, not just a phone line that is not humane, that has no warmth, right. Okay, as well. And those are the calls that I am getting at this level. I mean, this stuff is real.
Jocelyn, I'm thinking about this. Shouldn't we put the onus not just on people who many times are are illiterate, do not have the assertiveness to push back. They don't know what questions to ask. They are trusting of the healthcare system. What kind of advocacy, generally speaking, that's speaking for them that they don't have to speak for themselves?
Well, I think that the hospitals, right? When you have a loved one in the hospital, they have social workers, right? We're like, where are they? They're supposed to work with the families. They're supposed to make the connections, for the families. It's not, I get those calls. It is not done. People are afraid, our Black and brown community, of going to the hospital because they're going to get stuck with a bill. Where is a social worker or someone telling them, if you are undocumented, there's such a thing as emergency Medicaid, where you go to the hospital, you don't have health insurance, the state will pay for it. We do an application. You know how many of those I have done in the last 9 months? That the hospitals in Maryland are required to provide charity care. I mean, we need to have this information out into our communities as well. So we can say they need to be their own advocates. We need to empower them, but it's every system in society that needs to do that, okay? Every system in society, and we're failing. We're not doing it because we have laws that say you must, after you have a certain population, provide translation, interpretation, but we don't do it because oftentimes it's the bottom line for government, the budget. And that is really wrong. It goes back again to the fact that we don't empower our communities and we have not been funding public health for decades.
Now, Jocelyn, everybody's going to want an elected official like you to come to their community.
Yeah, exactly.
Because the level of frustration people must reach to say, I got to call my legislator because of the way my family's being treated. And then when you pick up the phone, and Jocelyn, and talk to the CEO of a hospital, it shouldn't come to that. But we need,
unfortunately, it does.
This conversation we're having, I've been on webinars since March. I'm not hearing that conversation other than what we're having right here.
But Stephen, I, on the other hand, am absolutely thrilled that those people had the temerity to pick up the phone and call their legislator.
Yes.
That is using their power. Whether they trusted it or not, they reached out to someone they thought could help them. Now, Jocelyn, I'm going to argue with you about the word empower because, quite frankly, I think of it as patriarchal, and I believe that we as communities have power. United, it's even a bigger power, right? It gets someone like you elected. Yay.
Mm-hmm.
But what communities need, as Matthew's teaching them advocacy, is they need information to do it right.
That's right.
And
that's right.
When they know about these things, that's more powerful. Knowledge is power. Yep. I have to put back on you, Omar. We cannot say, these folks are illiterate or they're this or that, and therefore we shouldn't they shouldn't have to do this. No, we want to teach them to use their power, to take those baby steps until it becomes a big muscle that they say, hey, I can do it.
I don't disagree with you. That takes time. Right now, we're pushing right now to vaccinate everybody within months, right? Of 300 plus million people, right?
Right.
What we're talking about, that's long term, Isabel. And I don't disagree with you.
No, you got to start now.
I don't disagree now, but we also need a system that's fair. Matthew, help me. Why aren't doctors and nurses and everybody, why aren't they saying, okay, you are a human being, regardless of your connection, regardless how much money you have?
We need them to get a vaccine. Omar, the best way to, at least with regards to COVID, the best way to solve the conundrum of people not getting their fair access to the care when they're already being hospitalized is to prevent them from getting the disease in the first place. And that's what this webinar is really about, is making sure that people have access to that vaccine. And when they have access to that vaccine, actually taking that vaccine. In my health center, we have access to that vaccine for our staff. More than half of my staff are not getting that vaccine. The younger people are not getting it. They're listening to social media that say, oh, but this or X or Y might happen to you, but you saw people dying in front of you. Our patients died in front of you, literally. And yet you're willing to listen to social media that you still might get infected. That is for this one particular problem, it's to get the vaccine, and then you won't end up being hospitalized. That's the key. That's what we need to focus on.
Somebody
the equitability of making sure that people get that.
Matthew, somebody asked the question. Well, all right, I agree with you that everybody needs to take the vaccine. In fact, let me be personal. Once I'm asked or once I'm given the go-ahead to take the vaccine, I'm going to take the vaccine. Let me be clear. So I'm personal. I'm saying, and let me also say this for those who may not know, I'm the former mayor of Tuskegee, Alabama, right? So we know about the Tuskegee syphilis, okay? All right, so let's put that in context. However, you know, I think it's important that when you're telling people to do something, you give them information. And what people are trying to do is get information so that they can feel comfortable with letting someone put something in their arm. Exactly. You know, even somebody said, sent me a note saying, well, tell me what are the side effects? I don't even know what the side effects are. I don't know what to expect or what could happen. You know, when you have medicine, they put on the bottle or something, they tell you, well, this can happen, that can happen. We don't really know what can happen with the vaccine. Do you, Matthew?
I agree with you that there is a lot of unknowns. There is a lot of unknowns. And I was hesitant before I got access to the vaccine. I thought, you know what, maybe I'd like to wait a little bit. Maybe I won't get access to it. I'll see what happens to other people. But at the end of the day, we all have to make this balance. Es una balance de las cosas. Nosotros sabemos qué va a pasar si recibe el virus. El resultado del virus es morir. It's the long haulers. It's the continuing of suffering. Yes, the vaccine has side effects. You could potentially have a headache, a fever, arm pain, headache. You can feel yucky for a couple of days. That's true. Just like the flu vaccine, you can feel yucky for a couple of days. But the number of deaths from the vaccine, there's been like 3 across the world from people who had underlying heart disease that had a heart attack. That's 3. That's not 4,000 people every day. And so, yes, there are side effects, and we need to be able to discuss those side effects openly and give people the truth, as you were talking about, Mr. Neal, giving people the truth, telling them what the side effects are, but at the same time, informing people that there's no informed consent that you get to sign when you get COVID. When you get the disease, you don't get to sign a consent. And so you get it, and it does what it will with you, and there's no telling that you will survive, and there's no telling how long you will feel ill for. And that is the part that we need to discuss most. Is how do we come up with those balances, and how do we convince people that the balance is in the plus side of getting the vaccine? I got my vaccine. I'm gonna get my second one on Friday. I look forward to it.
That's the conversation we gotta have, Matthew. That's the
Omar, and that's exactly what we did when we're trying to convince people to complete the census. We had to go out and talk to people and go into communities and tell them what benefit is, rather than saying this is something that's going to be against me. So it's the same concept that we have to be working, going into communities, having conversations like this, because let's be frank, if you don't have information, what questions are you going to ask? In this case, we're once again empowering them in knowledge, in letting them know what is it that you need to know in order to get this vaccination and be comfortable with. There is not a promise that you're not going to get sick or there are going to be other issues. Like everything has some side effect. Even breathing the air has side effect, but we're still here. But as you mentioned, COVID is coming to us and is not giving us any chances. Some people get without any symptoms, but some others die. And we don't want to be part of that.
So what I have been doing, sorry, Stephen, did you want to go to something?
No, I'm just going to say, I'm going to let you finish your thought. Amazing conversation. Omar, we're at the top of the hour. And after Isabella gives her comment, we're going to open this up to the audience that we have here who's been sending in questions. We've been curating their questions, and we're going to have everybody turn their cameras on, and we're going to have a community conversation here. Isabella, you got the floor.
So to arm ourselves with the facts, and to be able to talk to our communities, to Omar's point, Omar, I keep wanting to call him Omar.
Go, Omar.
To Omar's point, you want facts. So what I've been trying to get from the Pfizer people is how many Latino, African American, Asian American, Native American people have participated in those clinical trials. The best numbers I have currently are out of the 40,000 Pfizer, 13% are African, 10% are African American, 19% are Latino, but 6% of the Latinos are in Latin America. So on the US side, about 13% are Latino. And then I say to them, where are they from? Who are they? Are they all Puerto Rican? Do you have a lot of Mexicans in there? I said, if I'm going back to my community and tell Jose Perez, who is a Mexican, that 50 Jose Perez's were in that clinical trial, tested it, came out okay, with the exception of a few flu-like responses, then that means the vaccine is safe. It's been tested and it's safe to take. How do you feel about that, Mr. Perez? Oh, okay, that makes sense to me. But if we have these murky details, we're based on this, well, we've got a lot of response from our communities of color, and we have no data. That's not being authentic. That's not being transparent. We need the data. So I would say to you, you press your Pfizer folk or your Moderna folk, and the more they hear the voices from us, oh, Jocelyn, you can, state of Maryland, right on. Press them for the data. Say, in order to talk to my communities, I need to know who those people were. And the data they've shown me so far is they are spread around the country, but I still don't know the demographic data. I don't know the subpopulations of Latinos and the percentage of those subpopulations of people, because I think there will be some variation on the theme. Not huge, but, and that's when you get into the science, which I'm not going to get into. So I think we need to be more proactive in demanding from these folk, once again, information that helps us talk to our communities.
Okay.
That's where our credibility comes.
That's right. This is the beginning, not an end. So turn your cameras on, people. Turn your cameras on out in the community. And I'm going to take this first question we curated. Matthew, I'm going to come to you on this one. We need some clinical expertise here. And this question comes from Beverly. I don't see Beverly's Hollywood Square, so I'm going to read her question for you. She says this: please have someone address the side effects in detail, just like you tell a patient when they come. Headaches. Trump made it impossible to believe that this very quick vaccine is the answer. Black and brown people are the most affected. So lay it out to us, Matthew. And for the audience, tell us a little bit more about who you are and where you're from.
So my name is Dr. Matthew Kusher. I'm the clinical director of Plaza del Sol Family Health Center in Corona, Queens, New York, epicenter of the pandemic in March and April. Elmhurst Hospital Center, which was in the New York Times article that was explosive, is our safety net hospital. And we were the safety net for the safety net hospital. So that's where I'm coming from when I say that 50% of my community is antibody positive, and that was as of July. Highest in the state of New York, a state that saw 25,000 deaths in the span of 2 months. What are the side effects of the vaccine? The vaccine can cause headache, dizziness, fever, injection site reactions, meaning pain, redness, soreness. People can feel tired, fatigued, have a migraine. Typically, symptoms are 2 to 3 days at most. I will say my symptoms were 2 to 3 days as well. And those are the basic side effects. There are, of course, far-flung side effects, but even if you take a sugar pill, people have headache from sugar pill. There's a lot of placebo effect in that. And I personally thought my side effects from my vaccine were just placebo. I thought that I was just making it up to myself, thinking that, oh, I'm going to get these side effects, so I'm going to have it, until I checked my temperature and I really had fever. But I recognize how fragile life is and how fragile we are. And that is what I talk to my patients about how fragile we are and how it's a miracle that we're still here, in the community, given how much COVID we had and how close to death many of the patients were if they managed to survive. And so when we talk about side effects of the vaccine, there are of course side effects to those vaccines, which are similar to every other vaccine that we administer to people. But the side effects, but the fact is 95% effectivity of the Moderna and the Pfizer vaccine, which is nearly implausible to accept, except for the fact that we had more than 40,000 people in each of these trials. So it makes it more reasonable to understand and accept that that is a true case, that 95% is real, because many vaccines that we use aren't that effective, and we still use them because it does reduce disease. It does keep people from getting sick or dying if they happen to get sick. But in this case, the idea that we have 95% effectivity after 2 doses of the vaccine, it's unheard of, and it's a true medical miracle. It truly is. And that is what I tell patients. It is a miracle that we survived. It is a miracle that this vaccine is here. And yes, you could feel ill, but at the end of the day, this is a miracle to us. And we should thank heavens that we have the opportunity to take that vaccine.
Now, just a quick follow-up. Tell me if this is true, that if you have that soreness, and on the second dose, it's even more sore, is that evidence that it's working?
So the job of the vaccine is to create your immune response. You want your body to react. You want your body to recognize that there's something there and attack it. This way, the next time it sees it, it will know what it is and be able to rid it before you start getting sick. Because when your body first sees something the first time around, the virus gets its opportunity to run around your body and act like it's an amusement park. But if we're able to stop it at the door, which is what the immunity is meant to do, then we don't get sick. That is the whole reason. So the arm soreness, it's just because you're getting a large amount of liquid inside your arm for the most part. The other symptoms indicate, yeah, guess what? Your immune system sees this and is acting against it.
I wish people would explain it just like Matthew did. We need you to come to our barbershops, brother. Omar?
You know, Matthew, you're hitting on a point that was asked of me on a radio show I did just recently, where one of my guests asked the question, if I get the shot, both of them, am I immune from getting COVID?
So the answer is no. You're not immune from getting COVID. It's 95% effective, but what it does provide you is a lot more protection than if you have no vaccine at all. The best way is the community immunity, as was being discussed earlier. And that community immunity really, in conjunction with the vaccine, will help people prevent illness. So we think about measles. Why has measles reoccurred in this country? Why have we had pockets of measles? Because we've had decreased amounts of vaccination rates. When we have decreased amounts of vaccination rates and less people who are able to accept the virus and then able to give it off to other people, it gives even people who have had the vaccine are more likely to get it. If everyone is able to have the immunity, then even if the virus is there, there's nowhere for it to go, so that it can't pass on from me to you and then you to somebody else. The more virus you see, a bigger amount of virus that comes into your body and in contact with you, the more likely you are to be sick. If it's just a little bit of virus and you have the vaccine, you're probably not going to get sick. But if it's a lot of virus, your body's immune system might not be able to fight that off. And then you lose that sense of immunity.
So Omar, let's take another question.
Wait, just a minute, Stephen. I think that to finish what Matthew started, it's really crucial. Remember, this is a new vaccine.
Yes,
so
and a new virus.
We haven't had it long enough to understand how long that protection will last. So we can't say it's immunity, it's foolproof immunity. And no vaccine really is. That's why we get the flu vaccine every year, right? Because we don't know, well, I think they probably know basically how long you're protected. So they'll probably be doing research on the long-term protectiveness of these particular vaccines in this period of time to be able to tell people, yep, you need to do this every year. or every 2 years, or so that's where we're at currently. Omar.
And these are,
we really don't know how long the vaccine is effective, and so we're probably going to need booster shots, just like they do with the flu shot. Is that what I'm hearing,
That
Jocelyn?
The flu shot is different. The flu shot is different because the flu shot is based on different mutations of the flu. Think of it more like measles or tetanus, where you get a tetanus booster every 10 years. It's more like that as opposed to the flu vaccine. The flu is able to mutate very rapidly, and that's why we have to get a flu vaccine every year. We don't know how long the COVID vaccine will keep us safe because it's a new vaccine and it's all the studies are new, so we don't have long-term data to tell us. We do know that the two vaccines, the 2 dose, does increase your body's immune system response and thought to give you a longer duration of help, but we don't know for how long that will be.
But we do know that it's mutating now, right?
Correct.
Yeah.
We know it mutated now, but Pfizer and Moderna are pretty confident that that mutation is still going to be covered by the vaccine because the piece of the virus that we use to generate the vaccine hasn't changed. And that's the part that's most important. The virus has mutated to become more contagious. And even as far as March, in New York, we had the virus that was in Europe. In California, they had the virus that was in China. There was already different strains in March because the virus was here in January. So it's already been mutating, and it's going to continue to mutate, but it's not mutating as fast as the flu.
Okay.
So this is going to be a theme that we continue to have because we're now educating the community about how this thing works in plain language. Omar, let's take another question. You have another question from the audience?
In fact, what I want to do is I want to take a question from somebody. Cameron, did you have a question? Go ahead.
Yeah, I do. I received this question from someone in the community yesterday, and it was asking about the Moderna vaccine. It's 84% or 94% effective. And she was under the impression that that meant that 94% of people were fully protected and the other 6% were not protected. But to me, that sounded like each person across the board was 94% then like essentially immune. Is that kind of, which side does that fall on? Does that make sense?
We hear you.
Okay. Matthew, can you help us out with
that? We got several physicians in here, but
okay,
Matthew got the floor.
Let me also say this. If you know the answer to this, you don't have to be a panelist. Everybody's a panelist at this point. So if you know the answer, raise your hand and I'm going to try to get to you.
Right. Yolanda's a nurse working front lines. We have several physicians in the room. It's a good question because it's, population versus individual. It matters. The distinctions matter. And when it's reported in the press, it can be confusing to people. But the bottom line is when that effectiveness number came out, as Matthew described, like a miracle, it truly is remarkable. Truly is remarkable on a brand new platform, an mRNA platform. And that means that the future of vaccines development may fundamentally change moving forward. So that opens the door for new discoveries. So we want our community to be part of this, and they won't be part of it if they're not part of this kind of a conversation.
Dr. T, I know we have also have this conversation via Facebook. I'm wondering if in Facebook we're getting some questions.
Yeah, we have someone monitoring the Facebook feed as well.
All right,
let us know.
Let's take some more questions because we have just a few more minutes. Let's take some more questions. Raise your hand if you have a question or comment or whatever. Let me see if I can see someone. Do I see anyone? Don't be shy. Here we go. George, go ahead.
Go ahead, George.
Thank you, Mr. Neal.
And introduce yourself, George.
Sure. Thank you, Dr. Thomas. My name is George Matthew. I'm the Chief Medical Officer for a technology company called DXC Technology. We are trying to actually help out in communities or working to communities. We've reached out to Dr. Thomas. He was nice enough to invite me to today's meeting, and I've been very impressed by the dialogue. One question I had was, as we've gone through the chat, something that's come up a lot has been the idea of trying to collect or understand what's going on in our communities. Data has become really important, especially to a lot of the private companies that are out there, as well as the government. It tells you who's getting tested, who's getting the vaccine, what's going on. I think Ms. Duran had actually asked how many people or minorities that are getting the vaccine, and she couldn't get a straight answer. Are there any efforts from a community perspective they're collecting that data? Only because we're not getting the right data sources from these other folks, and it's supposed to be their job. And maybe it's time, just like with advocacy, we do it ourselves. So is there someone already doing that now?
That's a powerful question, George. And let me also add to that, and that is our credibility is predicated upon the information that we have. If we don't have the information, then we cannot convey it to people. Therefore, we lose credibility, and that's critically important. Okay, go ahead. Who wants to respond to that?
Let me respond.
Go ahead, Isabel, go ahead.
I know Jocelyn wanted to say something, but I think it's really critical. George, Pfizer hasn't necessarily been refused to give me the information. They gave me the information they had. I pushed further. I wanted more. And we as community need to learn to do that. That's our power. we need not to be afraid to ask these questions, but we need also for them to understand why we need that information. And one of the things that I think that they haven't been doing religiously is they say, oh, we have 1% minority engagement and we don't know what to do and how to get people to engage. It's because they don't understand that audience. They don't really understand that community. They really don't know how to reach out to it. And one of the things that I asked Pfizer to explain for my journalism media series, I want you to tell me what you learned outreaching to the community to bring in 13% Latino and 10% African American. What did you do? How did you work in community? How did you change your not so good practices in order to do this? And does it become a template going forward?
Sounds like you want to bring them right in here. Let's bring them right in here and ask them. Let's do that. Put them on the hot seat.
Let me not give them a black eye, okay? The people I've been dealing with at Pfizer are actually, most of them are communities of color. They understand the frustrations and so on, come from the Black and Latino community. So it's not so much that. It's just that when you're dealing with a behemoth, like a huge pharma company, and you're sitting there, once again, you're one person asking the question, pushing for this, say, you've got to do this, and nobody kind of listens. And then suddenly comes a pandemic and everybody's jumping up and down trying to figure out what to do about it. Suddenly what you have to say becomes more important. But I think to Omar's point, we really need ourselves to be informed. We need to maintain our credibility. We need to understand the information so we can go out and message to our communities. And to small pharma, I don't know if you're small pharma, George, I don't mean to insult your company.
Don't worry.
But I think it's really crucial that from the get-go, you begin to get demographic, ethnic data, racial, ethnic data, very, all the way down to the very bottom. There are 22 different Latino groups. There are about, 4 or 5 major in this country, Mexican being the largest. And if you don't know how to, work with those different populations, because they are different, messaging is different, the accent is different. Some of us eat salsa and some of us dance salsa. So if you don't understand our communities, you don't have opportunities to talk to us in a way that back to Omar, that you have gained trustworthiness. So I don't want to, this is an opportunity to pharma to also learn. And I'm still waiting to see if they're going to dance with us. Or they're going to do the same thing.
Let me say this, Isabel. There is a power dynamic. Before, people didn't have to learn how to talk to people who were in disenfranchised communities because they did not have the power to force them into. Now, because our whole survival is predicated upon those people having the vaccine and being safe to be around as well, now we got to talk to them. I believe that you have to make your friends before you need them.
Ms. Duranda, Mr. Neal is reading my mind, and I didn't intend to ask this as a provocative question, and only because
provocation.
no, because we are also in multiple countries. I was on a conference held by Duke earlier where they were talking with the government of Peru, and the Peruvian government actually turned down the Pfizer vaccine because they didn't agree with the terms as to how the vaccine was going to be administered. Something that was quite honestly against some of their rights as to how the data was being used. What I'm proposing in line with what Mr. Neal is saying is the data that's being collected now offers an opportunity for the community to shift that power dynamic, because the data that's being collected about the vaccine in terms of phase 4 pharmacovigilance studies isn't known yet. And these vaccines are dependent on this data to figure out how much they'll be monetized for in the future.
Oh, there you
Collecting
go.
that data and knowing it.
That's the word.
Now you got bargaining chips. Sorry, I spoke too much. Very nice to meet you.
And I also think that
That's right on time. Jocelyn, you were saying something. I hope you can remember what you were thinking. Go ahead.
We got Jocelyn, Gloria, and Yolanda. Go ahead, Jocelyn.
So yeah, yes, Isabel went ahead, but I wanted to say that the state of Maryland, I think it is up to policymakers at the state level. And also in Maryland, we have 24 different jurisdictions, 23 counties in Baltimore City, 6 million people. Every jurisdiction has a health officer. It is on us to make sure that we are collecting that data for everything, period. Because the data should drive the policy, not the other way around, right? The science speaks for itself. So I have a bill, believe it or not, that has a hearing next week. And Dr. Thomas knows because I have asked him to be one of my witnesses, that will require data by race and ethnicity throughout all the departments in Maryland.
A law.
We are tired of asking for it and no one has it. You know, that is really the truth. And I think it's important, especially with the vaccine, who's getting it? How many people got it? Where, what was the reaction? I think it's important as we move forward and we're drafting these messages. And I just want to say, Isabel, that, you can ask all those companies for the information about their trials, but I'm going to tell you, and you know the answer already. The answer is simply that not enough of us participate in those trials, Black and brown people. And they really need to make an effort to recruit us to participate in those trials. And that's the bottom line. And I think that, I know in Maryland, I had a conversation yesterday with one of the companies, and we have in Maryland, the Office of Minority Health and Health Disparities in the Department of Health. And I said that office needs to create a program where they basically work with these companies, and when they have these studies, we get the notice, we put it out to our community. We try to get the right information because we don't have the knowledge. And that is important so that we can participate and make it easy for our communities to participate as well. So what I'm saying is that, hold your elected officials accountable. All right. And we pass bills every year. Make sure that we're collecting the right data, because at the end of the day, we all get what is called a fiscal note with every bill. And that fiscal note will say whether or not, how expensive is it to implement. But if you have the data, you can justify doing it. And it's a lot easier.
And you can share that. You can share that.
A person who's not said anything. Nalita, can you kind of ask your question quickly?
Actually, good evening, everyone. My name is Nelida Berg, and I am the City of Portland Minority Health Program coordinator. So I'm from Maine. I just wanted to share some strategies that have been working really well for us, especially since I start working. I'm from Peru, and I have been working for the city of Portland for about 18 years now. And one of the strategies that I love to implement is, I agree with Dr. Durand, information, it's crucial. It empowers people, but in order to inform the community, you have to have an accurate information. So what I learned in this in this journey is that we need to include community members in before we are creating any plan, any strategies, any project. We cannot go out to the community and say, hey, the study, the evidence-based data say that Latinos have this high risk for so-and-so. Yes, it's good, but how is applicable in your community? How many of you, these Latinos, are in high risk? And then you develop a culturally and linguistic appropriate intervention for this particular population in this. So that way the community, you build a relationship, you build a trust with the community, then you are in a position to work hand by hand with your community members. But then the other piece is important. In order to provide an accurate information, you need the healthcare professionals. So I work with the clinical sector, with the social services, with the academia, depending on the topic. So I build a network, and then we all come together. And so for this stage right now, for the vaccine delivery, what we're doing is we are trying to get community forums to get the input from communities. What are the community members? What are the barriers that are preventing them to get the vaccine? And then we will be developing, okay, implementation, whatever implementation of we need to have in place, we can work, but the information has to come from the ground, from the community that you want to serve, you want to reach. You cannot go with your excellent PhD degrees and master's degrees and hi, here is your problem and here is your solution. That's it. Just want to share that with you all guys.
She dropped the mic on us, man. She dropped the mic on us.
Drop the mic, right? That's it. That's how you do it. Let me tell you something.
Love it.
But Omar,
I don't talk to Dr. T all the time about this. Lived experience trump your education. Okay, that's it.
But Omar,
Proof to power.
Omar, look how fast this has gone. I can't believe we are there. I've got to listen. This is a beginning, not an end. Our commitment is to make sure we have this space to gather these strategies, to gather these voices, and to have experts who can share this information. And we are going to have to save ourselves. I want to make sure that you're aware of what's coming up next. As we get ready to just have some closing comments from each of our panelists, but I want to show you what's coming up next. If I can share my screen here, I'm going to share my screen and let you know that our next webinar is going to be on Friday. This Friday, we have Faith, Science, and Trust, a COVID-19 community conversation with Dr. Anthony Fauci. And we have gathered together a panelist composed of religious leaders and individuals who have also signed up for vaccine trials. Now be mindful that the two vaccines that are available now, Pfizer and Moderna, are available because people volunteered to be human subjects in a clinical trial. And what I'm hearing from this audience, if we want to be in this space and have some agency in this space, we have to be willing to consider how we participate in these trials. By participation, we have agency. So I want you to get this word out. We're going to send it to you in the post-event materials. It's no charge. You can sign up. This is an opportunity. Again, Zoom has made it possible for us to have these kinds of gatherings virtually. And so we'll send this information out to you. So I want our panelists to think about right now, what is the take-home message? What is the take-home message that you want? And while you're thinking about your take-home message, let me thank the Office of Community Engagement, Dr. Gloria Aparicio Blackwell and her team behind the scenes helping making this happen. You'll get a link for evaluation purposes. And I want to thank our sponsors that have helped support the staff behind the scenes making all this work. So let's come back to the Hollywood Squares and let our panelists give us their take-home message. I'm just going to take them right from the top of the list. And I guess it's me. I need to stop sharing. Here I go. And so, Gloria, what is the take-home message from tonight's webinar?
Continue to listen to all this from the people that are doing this work. Continue to hear the information from facts. And also, February 16 is a Tuesday at 6 p.m. We're going to do a similar, it's going to be a webinar like this, and it's going to be all en español. So I'm waiting for Jocelyn to say yes for the 6th, but Dr. Carlos Del Rio from Emory University is from Mexico. I got him the front, and he's going to be talking about what it is that we need to do. Once again, February 16 at 6 p.m. Wait for the link. We're going to be sending through everyone that's signed up for this, and I look forward to see you. But read, get the information, ask questions.
Isabel Duran.
I have
take-home message. What's the take-home message here?
Take-home message is the more of our community we get vaccinated, the more we will achieve community immunity.
I love that. We're going to come up with a bumper sticker on that one, community immunity. Okay, do we have Matthew Kusher still with us? We may have lost Matthew if he comes back.
Patient.
Katrina, you still with us?
Yes, I'm still here.
Give us a take-home message and the one you're going to take to the salons when you tell people what you did today.
Let's get vaccinated and help save the community.
You know, that's a big change.
Community.
Big change.
Yes.
Okay, Jocelyn Pena-Melnick, our legislator. What's the take-home message here?
You know, there's a quote that says that without a sense of caring, there can be no sense of communication. We have to care about the Black and Brown communities. We can't just talk about them without investing in them, without investing in reducing those gaps. Okay, we have to stop talking. We talked a lot. Now is the time to pay up and to pass some good legislation that will really make a difference. We have to learn from all these lessons that we in the last 9 months. It's important.
Thank you. Yolanda, take-home message.
The take-home message for me is do it for the people you love. Do it for your community. I think that is critically important to really push past your fear. One of the Facebook questions that we didn't get to was, how do you do it when you're fearful? And I think push past the fear. So many of us have had to do so many things and survive so many things, and we keep pressing even when we're afraid. And so sometimes we have to move forward past the fear.
And I want people to know we're going to answer those questions. We're going to curate them. And when we post this link, the video, we'll have a link to the answer to your questions. Here's my take home. It's a bit of a quote before I throw it to Omar to send us off. It goes like this. It's about leadership. And we've had a failure of leadership that has gotten us into the mess we're in right now. It goes like this. Real leaders go to the people, live with them, learn from them, love them, love them. Start with what they know, build with what they have. But the best leaders, when the work is done, when the task accomplished, the people will say, we have done it ourselves. That's ancient. And that's what we have to do today. Omar, take us home.
You know, I want to first thank everybody who participated in this wonderful discussion. This is the kind of discussion that's going to really catapult us to the next level in terms of getting community immunity. But let us reflect on the words of Dr. Martin Luther King. Just yesterday was his national holiday. And so I leave you with his words as it relates to power. He says, power without love is reckless and abusive. And love without power is sentimental and anemic. But power at its best Is love implementing the demands of justice? As always, continue to love each other. For once you love each other, you will take care of yourself, therefore taking care of each other. As always, I'd like to leave you with these two words. Remember that I love you with a perfect love, but more importantly, remember this: you got the power.
All right, now we cue the music. Cue the music. Thank you, everybody. We'll send you out the link for the PowerPoint and the recording. We'll keep this room open for a bit. I'll put up the announcement for the Friday webinar with Dr. Fauci. And we are so excited that you were here tonight. And I hope you enjoyed this format. Please leave us your evaluation information so that we can do an even better job next time. Bye-bye.